Hello everyone, Michelle back here again. Today is day 8 after my strabismus eye surgery. Actually, I had the surgery 1 week ago today. It is Tuesday, and you can see that there's quite a bit of change in the amount of swelling in my eye, and really don't have the bruising anymore. That's pretty much gone away. Also, the redness in my eye is starting to fade, and I talked to the doctor today and found out that that's obviously the last thing that seems to go away is the redness in the eye. It does take quite a while before that's all gone. But it seems like that bright red is starting to turn a little bit more pinkish, but still red, but for the most part, not nearly as bad as it was when I first had surgery. I did speak to the technician today because sometimes when I'm looking in the mirror, I notice that my eye seems to be turned a little bit more esotropic or outward compared to what it would be if my eye were perfectly tracking. But she said that sometimes in the course of the surgery, the doctors overcompensate a little bit because there's a settling that takes place. And so it usually takes about a month for that to just completely shake out and for my eye to land in its proper position. So I'm hoping that that's the case. I do have still a little bit of that double vision going on. Not nearly as bad, though, that it was when I first came out of surgery. The other thing that I've noticed is when I'm driving, I'm getting a whole lot more peripheral vision on this side. As you remember, my eye was turned quite a bit toward my nose since birth, and now that it's been realigned, I'm actually getting a whole lot more peripheral vision on the right side of my head. So driving down the road, it's been adjustment. Let's just put it that way. Things are coming at me on that side of my head that I've never really noticed before, how close I am to objects, and that's kind of been a little bit startling, and it's taken a little bit of an adjustment to learn to kind of drive. But let me tell you, it's a fun experience because I've never had that experience before, so these are good times. Had a lot of positive comments from folks today as I went back into work for the first time today after surgery. A lot of people really noticing the tracking of my eye and commenting on how incredible it is that someone who had such a pronounced turn of the eye inward is now looking pretty much straight ahead, which is fantastic. I'm going to let you guys get a little closer look again at my eye so that you can kind of see the color and what it looks like. You can see that it's still quite red on the sclera part, and the swelling though is quite a bit down. But as you look at both of my eyes as they track together, you can see if I look left and I look right and I look up and I look down, there's tracking. I don't think the tracking is as well when I'm looking off to, say, the right as if I were to look off to the left. So I'm sure that it's all going to come together, and things are going to my eye's going to learn to work together with the other eye eventually once I'm able to go back to eye training. So again, thanks again for following my blog. I'll continue to update on probably a weekly basis so that you can kind of see the progress from week to week. But it sure is great being able to look into a camera and seeing two eyes looking straight ahead as opposed to looking into the camera and having only one eye look straight ahead. So I'm really pleased with the results so far, and I know they're only going to get better as time goes on. So take care, and we'll see you again next week.